Good morning, friends. Greetings from Oral Surgery and Beyond YouTube channel. We are going to learn today how to manage dry socket. Dry socket is a very common complication happening in every dental clinic. It is also known as alveolar osteitis. Though it is very common complication, but it is very difficult or rather say irritating to treat complication. Let us start. What is a dry socket? Post-operative pain in and around the dental alveolus, which increases in severity at any time between the first and third day after a dental extraction, accompanied by a partial or total disintegration of the intraalveolar clot and a foul smelling, is called a dry socket. Generally, dry socket is a complication mostly happening in traumatic extraction cases of old patients, and it is always associated with a spitting post-operative complication. Let us start. Its incidence is almost 3 to 4% after happening in dental extraction. It is mostly common in mandibular third molar extraction area. Its onset is generally after 3 days after extraction, and once it's happened, it will take times to heal, generally 10 to 15 days. So it will require 10 to 15 days of healing itself. Let us see what are the etiological factors. Generally, dry socket happen in the case of traumatic or difficult extraction procedure cases. Whenever we do the procedures more traumatically, or we require more bone cutting, or will require more gums flap opening, in such cases the healing is delayed, and many times if patient do not follow our post-operative instructions, then it is bound to happen he may or after surgery spit out the blood clot, and it is bound to happen the patient will feel a pain after 3 days, and it will become a dry socket. There are in literature there are some microorganisms are also causative agents of formation of fibrinolysis in alveolar socket, and it will cause a dry socket. The organism like Treponema denticola is a known organism. Sometimes what happens after extraction, we left the some small root piece or bone fragment unknowingly. In such cases also there is a no chance of formation of blood clot, or disintegration of blood clot happens, and dry socket happen. Physical dislodgement of the blood clot due to spitting, due to tooth picking, or due to smoking also one of the major reason for causing of dry socket. Some literature says some female patients on oral contraceptives are also reported for frequent cases of dry socket. Smoking is one of the major etiological factor happening of alveolar osteitis. During extraction, we mostly use a local anesthesia with adrenaline, and this adrenaline is a vasoconstrictor. Because of this, also the dry socket form. Let us see these etiological factors in details. Difficulty and trauma during surgery. What it cause the damage to the alveolar bone and its surrounding tissue. Due to the more damage, due to more healing required at the extraction site, there is inflammation of alveolar bone and gingiva happens. Due to this more inflammation at the site of extraction, there is a release of direct tissue activators into the alveolars and that region, which are the causing the fibrinolytic activity. Due to fibrinolytic activity, our fibrin clot is disintegrated and the dry socket form. As I said earlier, some microorganisms are also known for causative agent of dry socket. These are Streptococcus mutans, actinomyces viscosus, and the Treponema denticola. It is postulated in some literature that bacterial agents are involved in a fibrinolysis and that Treponema denticola may play a leading part in this process. That's why we generally suggest a post extraction antibiotic cover in all the extraction procedures, mostly a traumatic extraction cases. Actually, these are the anaerobic bacterial group, so that's why generally we advise in dry socket to prescribe metronidazole antibiotics also. Sometimes what happen during extraction, small root piece or small bone fragment left at extraction site unknowingly. Because of this small part, there is a disturbance happening at the wound healing site, and because of disturbed wound healing, there is a more chances of formation of alveolar osteitis. That's why in traumatic cases I always advise, if the procedure require more bone cutting or traumatic extraction, we should always, after extraction, we should always irrigate the extraction socket, clean it nicely, debride it nicely, and place the suture. Try to achieve a primary closure after the extraction. Sometimes what happens, after the extraction, we generally told patient in post operative instructions like do not spit or do not suck anything with straw, like any juices, but patient don't follow our instructions. Because of this also the negative pressures form in oral cavity, or the positive pressure also while spitting, and because of this pressure our clot is dislodged. So because of these physical factors and negligence from patient to do not follow our instructions, the blood clot is spit out or sucked inside, and these are the also contributing factor of initiation of alveolar osteitis. Some oral contraceptives are also reported, which has a fibrinolytic effect. Due to this, the in female young female cases, they are having a more frequent dry socket complications. So whenever patient such patients we see in our operatory that having a dry socket, we should ask case history in detail. Smoking is a major part in young male patients, because of which the dry socket happens. Because of smoking, the contaminants are go inside the our extraction site, and the sometimes what happens, because of this contamination and the sucking process of smoking, these both are leads to delayed healing and disturbance of the clot formation at the extraction site. Because of two reasons, the our alveolar osteitis happens and patient feels the pain. According to literature, there are 2.6% increase in the incidence of alveolar osteitis for those who smoke half a packet a day, 20% incidence for those who smoke one packet or more for a day, and the 40% incidence for those who smoke on the day of surgery. So it is most important the for young patients we should tell in our post operative instruction that he should not smoke for at least a week after extraction, otherwise he may encounter a dry socket condition. Adrenaline is a, as I said, adrenaline is a vasoconstriction, and because of vasoconstriction, there is a less blood supply at the site of inflammation or extraction while healing, and because of this, alveolar osteitis happen. This is given reference in Journal of Clinical Dentistry in December 2007. Let us see what is the normal sequelae of events after extraction. As we know, after extraction, the extraction site is filled with the blood, and the coagulation of blood and contraction of blood clots happen. Because of this thing, there is epithelial proliferation happens, and because of proliferation happen, there is start of the formation of blood clot. The at this extraction site, the blood clot and the other inflammatory cells are helps to formation of woven bone and the natural form at the extraction alveolar socket. So because of this process is not going well after extraction, there is a chances of dry socket formations are there. Let us see what are the clinical features, how the patients come to us after extraction for a dry socket. Generally, patients come after 3 days. Generally, severe pain arise after extraction after 3 days, and patient come to us like we are good for first 3 days after extraction, but now we suddenly start more pain at the extraction site. So the excruciating pain is one of the major clinical feature. When we see such a pain, a painful patient, when we examine such patient, we see there is an absence of normal clot at the extraction socket and non-healed extraction socket. And such patient generally complain with the halitosis also, and the base of the socket looks like grayish white in color, or a white denuded bone is also able to see. Floor of the extraction socket also we are able to see. So this is a clinical key points to identification of dry socket. So let us see how to prevent this dry socket. The first most important thing to prevent the dry socket is take a proper case history. If the patient having a medical conditions like diabetes or any bone diseases, or the patient is on contraceptives, so we can think about the patient is mostly potential for the happening of dry socket. So such a patient we have to plan accordingly. We have to tell patients before only ki we are going to, though it is normal extraction, we are going to put a sutures. The patient who are regular smoker, so these are also having a risk factor for happening of alveolar osteitis. So for such patient, the post operative instructions are very important. For such a patient we have to give a, so as I said earlier, there is always we should tell a post operative extraction instructions to the patient in details in patient's own mother tongue and in English also. So the patient is thoroughly should know our post operative instructions and their a scientific fact behind it. Generally, the smoking patient we should tell them he should avoid smoking. One more thing is careful planning of difficult extraction on diagnosed on radiograph. If like wisdom tooth, we see it's going to a difficult extraction or the some anatomical factors showing us that patient will require the osteotomies. In such cases, preoperative surgical planning and the post-operative and try to do a minimal or invasive extraction procedures, and post-operative sutures placement is mandatory. For such small things we can avoid happening of alveolar osteitis. After extraction also we have to tell patients to keep the oral hygiene good, like a betadine cleaning at the extraction socket, or while eating he should try to eat from behind so the anterior extraction socket does not get involved with the food particles. Like this, some post-operative instructions are very important. As I had said earlier, we have to tell patient that for the patient taking oral contraceptives, extraction should be ideally planned during their 23 to 28 days of tablet cycle to avoid a dry socket. One more thing is very important. After extraction, we should tell patient to avoid a gentle brushing for next 7 days, to then avoid vigorous mouth rinsing and garglings, and avoid spitting. For these instructions, patients can avoid physical dislodgement of blood clot and can prevent formation of dry socket. These all post-operative instructions should give to patient in verbal and written form. Let us see how to manage once the dry socket is happen. Actually, the as we see ki the patients come to us for the dry socket, they generally have a infected extraction site or extraction socket with no blood clot. So ideally, when such patients come to us, we should counsel patient first that this is a normal thing, sometimes happen post operative extraction, so we should counsel the patient. Then after counseling, calm the patient, take it the patient on your operatory, then see the extraction site. If possible, irrigate the extraction site, take out the any foreign bodies or tooth fragments or any food particles inside the extraction socket. After the thoroughly cleaning and debridement of the extraction site, then betadine irrigation should use to disinfect the infected site. After that, we can place a surgical dressing at the site of extraction. In such cases, we should always advise a post-operative analgesic and antibiotics. Then we should instruct the patient to keep the socket clean. We should tell he should come after regular interval to show to us that how do his progress of healing is going on. Whenever required, we should change the dressing pack if we are giving a dressing pack. As we know, there are several surgical dressing materials are available in market, like bismuth iodine powder with paraffin. Then some kind of alveolar gel is also present by the septodent. Then there are some kind of dressing gauze preform are also available in market, which having a property of antibiotic, antiseptic, and obtundent property. Generally, some neomycin tetracycline or metronidazole gel are also advised to place inside the dry socket pack. Then after extraction in such cases, or after debridement of such cases, we generally advise to use a chlorhexidine or betadine 5% to 10% to prevent a secondary infection at the site of dry socket. Sometimes tranexamic acid like antifibrinolytic agent or epsilon amino caproic acid also we advise for a patient like this. Then, as I said earlier, some obtundent like zinc oxide eugenol paste is also useful in placement and in treatment of dry socket. But I do not advise generally for the patient, because placement of such zinc oxide eugenol placed inside the socket can cause the secondary healing, can actually helps to avoid primary healing and helps to secondary healing, and it delays the dental socket healing. Of course it will helps to reduce the patient's pain. Of course this is one of the option mostly we use. Then what are the effective way of treatment of dry socket, we will see in our next slides. There are some advanced treatments are also there advised in some literature, like use of dextronomer beads. Like there are few articles which show these beads are helpful to promote the absorption of inflammatory and the bacterial debris inside the socket, and we have to replace these beads regularly, like ZOE pack we give in our dry socket patients. It will work as a same mechanism. It is also used in diabetic foot patients, so these beads are taken from that treatment part in our oral dry socket cases. So for summarize, I can tell you the some important points now. Generally, I advise the irrigation material, saline solution, sodium paraben solution, hydrogen peroxide solution, or 5 and 10% providon iodine solution, and chlorhexidine solution. Generally, I avoid dressing, but you can give a dressing like iodoform gauze, ZO eugenol block, and the antibiotic dressing, cotton pack. Then clot protection methods we should use like suturing and placement of gel form. Gel form is also helpful sometimes, so it will help to keep the blood clot at the site of extraction. Then some clot support agents like polylactic acid are also advised. Antifibrinolytic agent like epsilon amino caproic acid and tranexamic acid are also helpful, as I described earlier. Then what is a authentic method, or what is a very helpful method to prevent or the in the treatment of dry socket? Let us see. Actually, the induction of secondary bleeding at the site of dry socket is the key treatment, or you can say very helpful or very beneficial and the fast treatment to manage dry socket patient. Like after the induction of secondary bleeding, the socket is again filled with the blood, and after the filling of the blood, we should keep that blood clot at the site of extraction, and so that's why we should give again suture on that extraction site. So these all things helpful for formation of new clot, and it will stay at that site only. After this procedure, obviously we should advise antibiotics like metronidazole and the amoxicillin, and the analgesic like ibuprofen and this diclofenac sodium. I generally advise metronidazole in all my dry socket patients if happens. As we see many treatment modalities, but despite of different conventional and newer treatment modalities are available for management of dry socket, but the preventive methods, as I described earlier, are playing key role to prevention of occurrence of dry socket. um, Again, at the end, I am again summarizing my today's session by telling you the key treatment for dry socket is induction of fresh blood clot and the suturing. It will help to patient reduce pain faster, and the extraction non-healing site heal faster. The As I said in my show in my first image, you should induce a fresh blood at the site of dry socket with the help of osteotomy instruments like rotary instruments, burr, or the curates. Then after the fresh blood induction, let the blood flow inside the socket and maintain it at their place. After the blood is filled inside socket, we should use good suture over it. So this is a key treatment for management of dry socket. I hope you are getting many key points in my today's session. These are my references for today's session. For learning more oral surgery topics, please subscribe my YouTube channel Oral Surgery and Beyond. Thank you for today. Dr. Hemant Bhavnerkar from Mumbai.